You have completed Module A, and we will move on to the overview of human growth, development, and learning. In this module, we will identify major cognitive, affective, physical, and communicative milestones of typically developing children. We'll recognize some basic styles of human learning, and we will discuss the risk factors that may prohibit or impede typical development. Development is more than a cumulative list of changes and milestones. It is the accumulation of a personality and a whole being. There are many principles or milestones that are recognized in typical development, many of which will be reviewed in this module. Development is usually predictable, and that is how we recognize atypical development. Developmental milestones are attained at about the same age in most children. Environments that provide limited opportunities to children may result in the limited development of some children. Children progress through predictable developmental stages and phases as they grow and mature. Individuals, as we know, vary and may differ greatly. Universal Design for Learning, or UDL, is a set of principles for curriculum development that give all individuals equal opportunities to learn. UDL provides a blueprint for creating instructional goals, methods, materials, and assessments that work for everyone. Not a single one-size-fits-all solution, but rather flexible approaches that can be customized and adjusted for individual needs. Some of the UDL principles include multiple means of representation, such as providing information through a variety of senses, providing information in a format that allows learners to adjust volume or size, providing information using a variety of representations like equations on the board or manipulatives representing equations, photo of a word problem, hands-on math activities. It also can help students connect new learning to previously learned concepts and skills. It also allows children to show what they know in a variety of ways, like by providing options for physical actions, providing options for expression and communication, to share the information using a variety of means, either written, spoken, or through the arts, and providing tools to help with sharing information. Multiple means of engagement is working to gain the interest of all learners during activities, providing choices when learning is appropriate, or encouraging task engagement in a way that works for each learner, and it helps learners monitor their own learning through the use of self-regulation strategies. Cognitive development is the process of gaining knowledge and information as the person interacts with their surroundings. It depends on growth inside the person as well as the influence of the outside environment. Physical development is the acquisition of motor skills and learning to physically control one's own body. It is characterized by changes seen in the external body and by unseen internal changes in the muscles, bone, and nervous system. Affective development is the process in which a person acquires feelings about self and others and acquires the beliefs, skills, values, and behavior patterns necessary for interacting with others. Now that we have discussed the categories of development, please review the stages and examples of a typically developing child. This activity will ask you to review cognitive, affective, and physical stages of development. You will do the activity by developing a concept map, or if you will, a visual diagram. We often use this tool to help our students understand given content. This is your chance to post answers for the 4 questions embedded in your Moodle course and see other students' responses regarding UDL. How would you define the word resilient? Resilient is really a scientific word referring to a material that does not bend or break. Now the word describes people's personalities. Resilient people have stress-resistant personalities and learn valuable lessons from rough experiences. Resilience is the process of successfully adapting to difficult or challenging life experiences. Resilient people overcome adversity, bounce back from setbacks, and can thrive under extreme, ongoing pressure without acting in a dysfunctional or harmful way. Please take the resiliency quiz in your Moodle course to see how resilient you are. It should take about 10 minutes to complete. There are numerous causes for developmental disabilities. They are categorized as genetic influences and environmental influences. Physical and other characteristics for all people are shaped by our genes. They determine whether we are tall or short, bald or have brown or red hair, the color of our eyes, and more. Sometimes disabilities and other conditions are inherited as a result of the genes that exist in our parents. Many times a child's parent does not have the disability. They carry the genes from earlier generations. Genetic causes may cause mild or severe disabilities that may or may not be life-threatening. Some of those examples are genetically caused disorders like Down syndrome, hemophilia, PKU, Rett syndrome, or sickle cell anemia. Sometimes circumstances in a child's environment may cause the child to have a disability. Toxins in the air, water pollution, and lead poisoning are other factors that may have an impact on a child's environment and lead to a disability. For example, a child's family may have economical or other disadvantages that make it difficult to provide experiences that stimulate or encourage learning. Certain conditions can occur during the prenatal, perinatal, and postnatal periods and may place children at risk. Many disabilities are the result of something happening to the fetus while it's still in the mother's womb. If the mother has poor nutrition, has hepatitis or measles, uses drugs, alcohol, or smokes, her child may be born with a disability. Other factors have been linked to these conditions are medicines taken during pregnancy and food additives. Some disabilities result from conditions present at the time of birth. Being born prematurely, having a loss of oxygen, long labor, excessive hemorrhaging, or a loss of blood for the mother, early separation of the placenta, and direct injury to the head if instruments are used are sometimes events that happen during the birth process that may cause disabilities. After birth, these factors place children at risk for not developing optimally. Some of these factors are maternal deprivation, malnutrition, chronic diseases, and infections, hazardous substances, physical trauma, and stress. Other conditions that may place children at risk include an abusive adult figure in the home, mother and or father was a teenager at the time of birth, mother was 40 years or older at the time of birth, maybe the educational level of a parent raising the child.